The next presenter is Ayushi Chauhan. Yeah, she will be presenting on mystery of the missing eye.
Good morning, everyone, and thank you AIOS for giving me the wonderful opportunity. I'm Dr. Ayushi Chauhan, second year resident at Baroda Medical College, Gujarat. Here are some introduction points. Traumatic globe dislocation is a very rare clinical presentation and most commonly seen after the road traffic accident. Orbital wall fractures along with the frontal bone fractures are associated with the dislocation of the globe into the cranial cavity. Here I'm presenting a case in which we could not only achieve the cosmetic restoration but also the post-operative vision. Coming to the history part, a 30-year-old male patient residing at Vadodara presented in the casualty department with a history of road traffic accident with injuries over the head, face and both the eyes. On examination, there were the extensive facial injuries extending from forehead and involving the upper and lower eyelids of both the eyes. On general examination, patient was conscious, cooperative and oriented and patient's vitals were normal. Here are some of the photographs of patients on arrival. As you see that there is the extensive forehead flap present with multiple lacerations present over right eye and the left eye. On opening the right eye, no globe-like structure could be seen in it, only the bony fragments and hemorrhage could see. Left eye was normal with a vision of 6/6 and anterior and posterior segment normal. We go through the primary investigations in which the computed tomography scan of the brain in 3D CT phase was done, in which eyeball on both the sides was intact and with intact optic nerve with slight displacement of eyeball with frontal bone fracture. As after following the diagnosis, we primary suturing the laceration in the emergency department. Then we take patient to the further surgical management along with the neurosurgeon to reposit the globe in the orbital cavity. When the neurosurgeon raised the flap, and further exploration done to find out the eyeball. The eyeball was found in between the bony fragments and slightly displaced upward through the defect in the dura mater. Then we sutured the lacerated orbital tissue and try to reposit the globe into the orbital cavity and the further defect in the dura mater done by the neurosurgeon. Here are some intra photographs of the patient which was reproduced after taking consent of the patient. This is the immediate post-op photograph. After 1 month, patient's vision in right eye was 6/9 with complete ptosis and enophthalmos, but with an absolutely normal anterior and posterior segments. CT scan of the head and orbits provided a detailed location of the luxated eyeball and provided guidance in further management of the case. As in our case, after the CT scan, we could know that their eyeball was present there. Before that, it was a mystery for us where was the eyeball. In such scenario, early diagnosis and immediate globe repositioning is crucial for patient's visual recovery if the optic nerve is found to be viable. Early intervention is the key to salvage such eyes in view of the psychological benefits and for cosmetic reasons. Thank you, everyone.
Any comments?
That only really that I would suggest that in main halls, this kind of one case at least after every session, let it be in the last.
Yes, sir.
But you know, these kind of rare cases must be known to whole people.
Yes.
That you can come across something in the life like this, which you have never seen, never being discussed anywhere. So discussed here means a lot of delegates would not know that there are cases like this, and especially younger ones. We like people have seen everything. We have seen the no eyeballs in the children in few villages in Bihar around a river. There are 3-4 villages where the eyes are missing since birth, either one eye or both eyes. I was taken there by a Bihar doctor and then American team came, ICMR team came. I don't know what happened then. I wrote to ICMR also to find out what is happening there. There are, like I saw, at least dozens of children with missing eyes. Anophthalmos completely, both eyes or one eye. And they were not genetic, like not one family. The bride was from somewhere else, bridegroom was somewhere else. And I don't know, really, it's worth visiting those areas if you are keen on that. So I'm saying these rare kind of things must be shown to the wide delegates present. that this thing can come to you. And don't operate ptosis. Look for cystic sarcosis.
Yes, sir. Yes, sir. Thank you,
That's
sir.
great.
Thank you, sir, for